Hello, everyone. I'm Dr. Christopher Still. I'm a professor of medicine at Geisinger Commonwealth School of Medicine and the director of the Center for Nutrition and Weight Management here at Geisinger in Danville, Pennsylvania. I'm an internist by training and an obesity medicine specialist that's been in this field for almost 30 years or over 30 years now. And I've had the privilege to take this course that we're going to talk about and also present to other providers. So I welcome you, and I think that you'll be very happy with the program. And I hope that you have the opportunity to discuss and facilitate and help other people's in patients' weight loss journey. Why I think this educational process was so valuable for me is that we had the opportunity to do the self-assessment. So I gained knowledge of what I wasn't comfortable with that helped me be more familiar and more confident in giving presenting that information, listening to the experts do it, if you will, and then really how do we go back and engage and put it all together, if you will, to that individual program. And I think that unlike any other programs that I've done, having these three pillars or these three types of assessments, listening and then learning and giving back was really knowledgeable and novel. The first part of this training is a self-assessment. And I think a self-assessment is helpful for all of us. I learned a lot in taking it myself. And I think is that we're able to review questions and see what questions and knowledge that we're comfortable with and other areas that we may need to bone up on. Because I think we need to be comfortable with the information before we present it to others. And this is a great opportunity for us to learn. And there's also resources available that we can learn more or go into in-depth information about things that we're not sure of or we'd like to learn a little bit more about. The second part of this is what I thought was a great opportunity. So we are able to view and listen to experts who have actually given this presentation, the full library of 150 slides. And they go through and they highlight the importance of each slide and nuances of how to present that slide. And so when we're giving this, out of that 150 slides, we can, on our own, pare it down to about 40 slides to give in about an hour's time. So it's really a great opportunity to customize all this up-to-date and evidence-based information to present to our colleagues on this field of obesity and its treatment. I think SMART goal action planning is really important on an individual program basis because everybody has different issues or different challenges, I should say. And using the SMART goal action planning, an institution or a practice can take one item, assessing BMI or, talking about just bringing up BMI and talking about their weight. So I think taking one thing and these action plan goals really helps facilitate meaningful change and not just short-term change, but long-term and long-lasting change. So I think the principles of this SMART goal action planning is really a great thing. And it really takes some time sometimes to think about what priority the program wants to make. But once they do that, I think if they can ingrain themselves and make it into an ongoing practice style, it will behoove not only the providers, but most importantly, the patients. Now, one thing that I like about this that the learners or colleagues will take away from this is that this program or this course is very clinically relevant. And so once you complete this, I think it is very practical that will help you. So the next time Mr. and Mrs. Jones come into your clinic, you'll have better tools in your toolbox or better knowledge base to try to treat those individuals to help them through their weight loss journey.